Understanding ankle sprain recovery.
Ankle sprains are common injuries that can take weeks to heal fully. Proper rehabilitation is crucial to restore strength, flexibility, and balance. Choosing the right exercises can help prevent future sprains and speed up the recovery process. Here are 5 effective exercises recommended for regaining mobility and supporting recovery after an ankle sprain.
Exercise 1, Ankle Alphabet.
The ankle alphabet is a gentle, early stage exercise. While seated, lift your injured leg and use your big toe to write the letters of the alphabet in the air. This movement increases mobility, encourages blood flow, and gently stretches the ankle, helping to restore motion and reduce stiffness without putting weight on the injury.
Exercise 2, Towel Stretch.
The towel stretch helps regain flexibility in the ankle and calf. Sit with your leg outstretched, loop a towel around the ball of your foot, and gently pull the towel towards you until you feel a stretch in your calf and ankle. Hold for about 15 to 30 seconds and repeat several times. This exercise reduces tightness and promotes better range of motion.
Exercise 3, Ankle Circles.
Ankle circles are simple but effective for improving mobility and circulation. While seated or lying down, slowly rotate your foot clockwise and then counterclockwise, making full circles. Aim for 10 circles in each direction. This helps loosen joint stiffness, increase flexibility, and prepare your ankle for more advanced rehabilitation exercises.
Exercise 4, Resistance Band Strengthening.
Strengthening the ankle with a resistance band is a vital step in recovery. Sit with your leg extended and loop a resistance band around your foot. Push your foot away from you and then gently pull it back, working against the band's resistance. Perform the movement in multiple directions, up, down, left, and right, to build strength in all ankle muscles.
Exercise 5, Balance and Stability Training.
Improving balance is key to preventing future ankle injuries. Try standing on your injured foot while holding on to a chair or wall for support. Gradually increase your balance time, and as you progress, try balancing without support. These exercises retrain your muscles and nerves to react quickly, reducing your risk of repeat sprains.
When to progress and seek advice.
It's important to listen to your body and advance exercises only when you feel ready, without pain. If swelling, pain, or instability continue, consult a healthcare professional or physical therapist for guidance. With patience and consistency, these exercises can help you regain full function and safely return to your normal activities.